My name is Jay Kutzbeck. I'm the Director of Health and Counseling, and I've been here 12 years.
What steps are you taking, or is the Counseling Center taking to prevent the spread of COVID-19?
So keep in mind that we were ready for it long before the United States was, meaning, I shouldn't say that, long before all of the attention was given to it. So we had, the equipment we needed. We had a plan should we have a student come in. So we were ahead of the game, meaning when it was going through in China long before the initial case came to the United States.
Okay.
So we were ready from that. We had policies and procedures in place. So some of the few things that we've done since it's received so much attention in the media and so much attention worldwide is, so right now we actually have our front doors closed. And so there's not sort of free access to the Health and Counseling Center. We have someone in the lobby. They go out and do a quick medical assessment to make sure that person is not experiencing a fever or any other symptoms that are consistent with the COVID virus. And then once we do their screening, we'll either provide whatever treatment we can there, or we would, bring them in the building and do, whether we have to do a lab test or a further exam. So limiting access to the Health and Counseling Center itself is one thing that we've done. We're doing certainly a lot more of our visits telehealth and on telephone, so students aren't having to come in for their medication refills. So that would be another thing that we're doing to prevent the spread.
Nice. And speaking a little more on symptoms,
Mm-hmm.
someone like me, I have seasonal allergies when
Mm-hmm.
pollen is around. How do you know any signs or differences where you can tell if you have? Because I'll have a slight cough
Right.
maybe, and then I'll definitely have a runny nose and itchy eyes. But for me, that's just typical allergies.
Yes,
So
I
how would you?
have the same exact problem,
Yeah.
which is really hard. I was actually traveling a couple weeks ago and I had a cough and I was on a plane. And so I was trying to prevent myself from coughing. But the two sort of telltale signs of COVID, the ones that people most likely will have will be a fever is the number one sort of symptom. And then the second one is a dry cough. I think I don't know about you, but a lot of allergy coughs, you kind of cough up something sometimes.
Yeah.
So that's not usually a dry cough, but those are the two symptoms that people with COVID generally have the most frequently. And then there's also a variety of other things that are like runny nose. Some people have nausea, but those are really much lesser than the first two that I mentioned. But
So the
as
main
you
ones
stated,
would be-
it's hard because it's a physician making a call based on a group of symptoms that a lot of people have for a lot of different reasons.
Okay, so that brings me to my other point. Is there any testing available on campus or off campus nearby, or are we kind of limited with that in Asheville and UNC Asheville itself?
Well, the testing capabilities is a problem nationally. So
Yeah.
that I was actually this afternoon, I was researching that a little bit. And so we actually had drive-by testing here in Asheville last week or the week before. That was done by the Buncombe County Health Department. We actually have 5 test kits here at the center, which we have not used yet. But the general rule now, according to the CDC, is you only should be testing people that are either in the at-risk category or that have severe symptoms. So let's say the average student who just may be feeling a little sick, you wouldn't test that person according to the CDC.
Okay. Are there any confirmed cases that you know of? I think we just got an email. I just checked my email, and it seems like there's one person off campus. Yeah. So is that the only one?
That is the only case I'm aware of that has an affiliation with UNC Asheville.
Okay. Did they come to the Health and Counseling Center, or was it they did a test on their own?
No, they did it on their own, and their last time they were on campus was the 6th, that Friday. So because of the timing, they didn't present any risk to the campus. And I think they also pretty much identified where they contracted that. They were able to identify the contact, so there was no risk to the campus at all.
Okay, that's good. What advice would you give students who are watching this?
I would say that if this is something you have to pay attention to, and it's not something that you should just blow off and think that it's not important. Because although it may not be a risk to the average healthy 20-year-old, if you come in contact with people over 65, or you come in contact with people with diabetes or asthma or lung disorders, getting this virus can be very dangerous to them. And so while it may not make the average student sick, they may even have it and not know it. They would have the ability of giving it to somebody else who it could make very sick. And so I think that's just an important message that students need to hear.
Okay, awesome. Do you have any final remarks? Those are basically my questions.
Just that, I mean, this is a very weird time. Our country has never experienced anything like this in the modern era. And I was just watching a thing from the World Health Organization. It's also been the first time anything like this has happened with social media, and some of the issues social media present in terms of misinformation and creating, providing information, but also creating, unnecessary drama. So it's just a very interesting time. We'll get through it. And I think people just going to have to be patient. Something Americans, I don't think, generally are well equipped to be.
Yeah. Yeah. Well, I appreciate you doing this.